Alrighty. I think people
Let people
are
join.
trickling in.
Yeah.
There we go. Nice. All right. Hi, everyone. Thank you for joining us. While we wait for some more attendees to join, I just want to go over a little bit of housekeeping. We will have a Q&A session for the last 15 minutes or so. So I just want to redirect you to the little Q&A box at the bottom of your Zoom screen. There you could submit questions that you may have. You could submit them anonymously if you like, but feel free to utilize that question box. And you also have the ability to vote on questions you want to see answered. So the more votes, the more likely it will get answered. We also have a survey that we're going to send out, but more on that later. And with that, I'll pass it on to Tracy.
Well, welcome everyone. Thank you for joining us today. We're excited about this topic that Tammy's going to talk about. Tami and I have known each other for longer than we care to talk about, I think.
And we still remember.
Yeah, we still remember. We kind of grew up in the Los Gatos area. Our families were together, and then we kind of went our separate ways and found each other again on LinkedIn. And I was pretty excited about what Tammy's does, and she was kind enough to say, sure, I'll do a webinar for all your people. And we did one with the client advisory board, and they enjoyed it. And Tami knows her subject really well. When I was thinking about this the other day, I was listening to John Mayer's song called Gravity. And John Mayer was saying, and I'll paraphrase, he said, essentially that, get away from me, gravity, all you do is drag me down. And it made me think about things that we, sort of get frustrated about. And sometimes we just get frustrated about them because we don't know about them. We don't understand what's going on. So the more we learn, the better equipped we are to handle it, whatever situation might be. It's kind of the same thing with the markets as professional investors. The more we know about markets, the more you know about investor behavior, the more we know about behavioral finance, gives us insight into what's happening and gives us patience. So that understanding gives us patience, and it kind of quells the frustration. And I think, Tami, that dovetails with what you're going to talk about today a bit.
Yeah, absolutely.
So without further ado, I'm going to let Tami take it. Tami's an expert in this area. She's written a book on it, and she can talk to you a little bit about that. So once again, Tami, please take it away.
Okay, thank you, Tracy, and thank you everybody for joining us today. As Tracy mentioned, my name is Tami Anastasia. I am a dementia consultant, educator, and the author of Essential Strategies for the Dementia Caregiver. And my book is actually a fabulous resource for anybody who is caring for a loved one with dementia, or for any professionals who are caring or interacting with anybody with dementia. Chock full of strategies and a wealth of knowledge that, again, as many people have said to me, it's like a handbook. So you can get that on Amazon. And also I have a private practice, and I provide one-on-one counseling, dementia guidance, emotional support, and care strategies to family and professional caregivers. I also provide counseling for people living with dementia, as well as the cognitive and physical stimulation. And then I also facilitate several caregiver support groups throughout the Bay Area. And most recently, I do a national Q&A every Monday from 4 to 5 for the Dementia Society of America. And anybody and everybody's welcome to ask any question, and I'll do the best that I can to answer. And then today, I would really love it if some of you have questions, and you can ask me those at the end of my presentation. So today I'm going to talk about the warning signs of dementia. I'm going to begin my presentation, though, by clarifying what dementia is, because there's a lot of misunderstanding and a lot of confusion about exactly what dementia is. Dementia is a progressive, physiological, degenerative brain disease, which means whatever's happening to the brain is slowly going to deteriorate over time. It's slowly going to get worse over time. And currently there is no cure. And dementia is a general term. It's like a category Cancer is a category, names all different types of cancer, is under the umbrella of cancer. Well, dementia is the category or a term that we use to describe people with different types of cognitive impairment that interferes with daily living. And that's the key. The cognitive impairment has to interfere with daily living, because that's what determines it to be dementia. And also, a lot of people think dementia is just loss of memory. It's so much more than that. So now I want to talk about how dementia affects the brain. So dementia can affect our memory. What we tend to see very early on is short-term memory loss. They can't remember things that they said or did minutes ago, hours ago. And it can be incredibly confusing because they may be able to remember things that happened 30, 40, 50 years ago. And you're thinking, well, I don't know if my loved one has memory loss, because they can remember things from 30, 40, 50 years ago. Short-term memory gets impaired usually first, and long-term memories are stored much, much, much longer. So we're going to see short-term memory loss before we see anything long-term. So this is really good to know, because people will say to me, well, I don't think my loved one has memory loss because they could, remember an event that happened 30 years ago, but they can't remember what they ate 30 minutes ago. They can't remember a conversation they had an hour ago. That's short-term memory loss. And that occurs when the brain is impaired in the hippocampus part of the brain. Also, it will affect language. Words become very, very challenging for a person who has dementia. They will use words in the wrong context. They'll use the wrong words. They'll say things that just don't make any sense. That is also damage being done in a certain part of the brain that affects language. And then thinking and reasoning, dementia will affect their thinking and their ability to reason. As a matter of fact, as dementia progresses, what will often happen is they'll lose the ability to think rationally, and they're going to lose the ability to process information logically. And as dementia progresses, then it becomes very difficult to reason with them. As a matter of fact, at some point, you cannot reason with them. Again, this is all impairment that occurs because of dementia. And then also it will affect our executive functioning. Executive functioning is what allows us to complete tasks. It's what allows us to get tasks done. It involves planning and scheduling. And once we have impairment in that part of the brain, then the executive functioning is compromised. So these are all things that dementia causes. And I'm saying this because once a person gets diagnosed with dementia, what you need to know is they don't have control over the things they say and do now. And often they'll get blamed, and you need to realize this is damage being done to the brain as a result of what's happening to the brain cells. Also, personality. We will see changes in personality, and that can change on a dime. So someone who's always been very low key, very mild mannered, all of a sudden may become very agitated, very angry, and start using language you've never heard before. And vice versa. Someone who's always been very angry and on the edge and impatient might all of a sudden become very sullen and mellow. So just know those personality changes can be due to what's happening inside the brain. And then they will have impaired judgment. Dementia affects judgment. And this is what makes them so incredibly vulnerable to being scammed. Someone who's always been very on heightened alert and always not trusting of people, all of a sudden is very trusting of people. So when someone is living with dementia, and if they're living alone, then we've got to do things to protect their finances, because again, they're easily swayed. And as a matter of fact, I have a client, and she was the daughter of her father. And I was telling her, I think it's time we got to get your father in placement. And she was kind of dragging her feet. Well, come to find out, she does his books every week. And he had sent a $50,000 check to someone I don't know how she found the address. She went driving down to the post office, got there just before they closed, and found the envelope. So impaired judgment is part of a symptom of dementia, as well as problem solving. They lose the ability to problem solve. And then also the visual spatial perception will become compromised. As a matter of fact, their field of range will become very, very narrow. And also they'll start misperceiving what they're seeing. They'll have these perceptions that don't make sense. One of the things that we do when someone, we call them when they wander, when they elope, when they try to get out of the house suddenly, we'll put a black mat down on the floor in front of the door that they want to go out of, and they may not go out that door because they see a black mat and they think it's a hole. So their perceptions, the visual, starts getting compromised as a result of dementia as well. And then mobility will become compromised, and we'll see they'll walk differently, their gait will be different, they might shuffle their feet, we might see muscle stiffness, rigidity. And I just want you all to know these are all things that are caused by dementia. And there's over 100 different types of dementia. So what I want to do now is go over the 4 most common types of dementia. Alzheimer's disease is the most common type of dementia. So a lot of people use Alzheimer's and dementia interchangeably. And I want you to understand dementia is the category. Alzheimer's is the disease. Alzheimer's is the most common type of dementia. And about 60 to 80% of dementias is Alzheimer's. And Alzheimer's signature characteristic is short-term memory loss. We often know if somebody's experiencing short-term memory loss, that's usually indicative of them having Alzheimer's disease. And what causes Alzheimer's disease is what we call amyloid plaques, and these tau tangles build up, and there's clumps that interfere with the cells being able to communicate with one another. And you want to think of the brain as our communication hub. So everything that we think and say and feel has a lot to do with those cells communicating with one another. And if there's interruption to those cells communicating, then we're going to have impairment. And this is what happens, is that we see these buildups of these tangles and plaques in the brain, and it interferes with the communication center. And then the second most common type of dementia is called vascular dementia. And vascular dementia often occurs due to restricted blood flow, oxygen getting to the brain. We'll often see TIAs, transient ischemic attacks. They are called mini strokes, MINI, mini strokes, or they could have a major stroke, or we'll see narrowing of the arteries, but it has to do with the blood flow and the oxygen getting to the brain. And the signature characteristic for vascular dementia is we'll see some impairment in their thinking. Their thinking is off. What they're saying is off. They don't make sense. And this is usually an early warning sign of dementia, vascular dementia. And also there'll be increased confusion. For example, one of my clients went over to see her mother, and her dog went with her, and the mother looked at the dog and said, whose dog is that? And my client's had the dog for 8-9 years. So there'll be increased confusion. I've had clients who go to the grocery store, a store that they've been to frequently, and they'll say to their loved one, have I been here before? So we'll see increased confusion. Then the third type of dementia is called Lewy body dementia. And the person who put this on the map, this is what Robin Williams was diagnosed with. And Lewy body dementia, its signature characteristic will be visual hallucinations, or they may have auditory hallucinations where they hear sounds, they hear voices. But visual hallucinations is often a characteristic of Lewy body dementia. And they often will see either cats, dogs, animals, or they'll see children or people. Those are the most common hallucinations. I have a client right now, and her husband, when there's leaves on the trees and there's a wind, he thinks there are people that are fighting in the trees. So this is a classic symptom of Lewy body dementia. And what causes Lewy body dementia is there's these abnormal proteins called Lewy bodies, and they clump up together and they interfere now with the messaging going back and forth with transmitting communication between the cells. And what you need to know about dementia is as it progresses, what's actually happening is the brain is atrophying, the brain is shrinking, and brain cells are slowly dying off. So it's important to understand why all these changes occur. And then the fourth common type of dementia is frontal temporal dementia. And we've all probably now have heard what that is because of Bruce Willis. And frontal temporal dementia occurs when there's damage behind the forehead, or there's damage behind the ear, the temporal lobes. And what that signature characteristic will be is that they'll have language problems, and more importantly, we'll see behavior changes and personality changes. And what you need to know about frontal temporal dementia is we don't tend to see memory loss in the earlier stages. Memory loss is something that happens down the road. What we tend to see very early on is difficulty with language, communicating, Bruce Willis, and then personality changes, and then behavior changes. So it's just good to know these are the four most common types of dementia. Their symptoms are very, 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 very similar in many, many ways, but I wanted to kind of give you a hallmark distinction between what each of them are. And the disclosure is that the content I am sharing with you today is for informational purposes only and is not intended to assess, diagnose, or treat any mental health condition. This information I'm sharing with you is not a substitute for a mental health evaluation by a professional. I have been instructed by my attorneys to make sure I read that disclaimer. Okay, next, now let's talk about what are signs of normal aging. I cannot tell you how many people are concerned that, well, if they forgot something, oh my gosh, do I now have dementia? So let's clarify, what are signs of normal aging? First of all, what you all need to know is, just as our body ages, we slow down physically, well, so does our brain. It slows down. And there are things to be expected that are going to happen as our brain is slower at processing information and communicating with us. So it is normal to enter a room and forget why, and then, oh yeah, that's right, and you remember later. It's expected this is going to happen. It is normal to miss a monthly payment, but you realize it. It is not normal if there's stacks and stacks and stacks of bills and payments that you've been missing. So I'll use myself as an example. I've always relied on a hard copy to remind me. I'll get something in the mail. I'll get a bill in the mail to remind me I have to pay a bill. Well, now a lot of things are online and I'm still not used to doing that. And so I miss a payment and I'm like, oh my gosh, but I realized I missed a payment. So it's that ability to remember, it's that ability to realize something is going to be a sign of normal aging. Then saying the wrong day and correcting yourself. Well, I think every single one of us experienced this through COVID. My gosh, we were locked in for a year and a half. Our whole life was totally, turned upside down. Everything we were used to doing all of a sudden came to an abrupt stop. And we got confused. I mean, it's normal aging to have the wrong day, but you're able to correct yourself. You're able to say, oh my gosh, wait a minute. Today's not Wednesday. Today is Thursday. So it's normal aging. And then not being able to think of the correct word, but it comes to you later. That is normal too. You may not be able to think like, what is the word? What is the word? And then, oh my gosh, oh yeah, that's the word I'm thinking of, right? That is normal aging. It's when you use words incorrectly or out of context. That's when we become very concerned. So if you can't think of the right word right off the bat, oh yeah, but then you can think of it, that's normal aging. And then being absent-minded, yeah, we're going to be absent-minded at times, and we're going to be distracted. For example, I went into the kitchen the other day and I wanted to get something. Well, my phone rang. I picked up the phone. I was talking to this person and I said, oh, wait a minute. What did I want to get in the kitchen? Oh, yeah, that's right. And then we're going to be preoccupied. But I do want to say this. If any of you are taking care of a loved one or someone who is living with dementia, being absent-minded, distracted, and preoccupied is totally spot on, given the demands and the responsibilities you are inundated with day in and day out. So many caregivers, my private caregivers, are going to say to me, oh my God, Tami, I think I'm getting dementia. They are so incredibly overwhelmed and so distracted and so preoccupied. It's event specific. They don't have dementia. They truly are so overwhelmed that they are distracted and preoccupied. And then it will take longer for us to complete tasks. I know we all get kind of angry and impatient, and we can't do things as quickly as we used to do. And multitasking becomes more difficult, but that's normal aging. And we just have to give ourselves permission and understand, as Tracy said earlier, the more we understand, the more patient we can be with ourselves. So it's to be expected. It might take us longer to complete tasks. And normal aging is that you're still able to retrace your steps. You can still retrace your steps. What did I go into that room for? I can retrace my steps. Where did I put such and such? And being able to recall and retrieve information. These are signs of normal aging. You're still able to recall and retrieve information. And you're still able to recognize familiar people, places, and items. So I hope this gives you all more peace of mind and allows you to see that a lot of things are normal aging. But now let's talk about what is considered not normal aging. What are now some warning signs of dementia? I'm going to go through each one of these. Experiencing memory loss and increased confusion. It is not normal to not remember a conversation you had 30 minutes ago, an hour ago. It is not normal not to recognize familiar places, people, and things. Increased confusion. It's one thing if you've never been there before and maybe you got lost, and it's another thing that you've been there umpteen million times and you're totally confused. Repeating the same thing over and over again, huge warning sign that there is cognitive impairment, and that is where they're going to ask you the same question over and over, and they are not doing that on purpose. What's really happening is they don't remember asking you the question, and or they don't remember the answer. So that is a huge warning sign of dementia. Being unable to follow directions, such as a familiar recipe. Now, let me explain that. If you've been a cook your whole life, if you've loved cooking meals, and you have been cooking family recipes for years and years and years, and now all of a sudden you can't follow that recipe, or you can't remember the ingredients that go in that recipe, that's a red flag. So it has to be something you're used to doing, and it's very, very, very familiar. And now all of a sudden you can't follow that direction. You can't do it. Something else that happens to our memory is what we call sequential memory. So with dementia, I can't do things in sequence because that, again, that communication is being interrupted, and I can't go from point A all the way now to point Z, right? That sequential memory is now being impaired. That has a lot to do with why we can't follow directions, why we can't do things in a specific order anymore. Demonstrating impaired judgment, it's just going to be off for the person. Sometimes we joke like, I have impaired judgment often. I made a bad decision. It's not that. It's that you're really have impaired judgment. You're doing things that are putting your life, your safety is in jeopardy. You're doing things that can really get you in trouble, and you have no awareness whatsoever of it. That's impaired judgment. Not because you made a bad decision about this. It's impairment in terms of not understanding the consequences of your choices, of your decisions. Getting lost going to or from a familiar place. This is a huge warning sign of dementia. As a matter of fact, I have a friend, brilliant surgeon, smart as a whip, and had been making rounds at the hospital. And on her way home, she called me and said, I am lost. I cannot figure out how to get home. And she was like literally a mile away from her home. So getting lost, going to and from a familiar place. Also, since I'm on this, if you start seeing dents in a car, in your car, your loved one's car that weren't there before, those are red flags, warning signs that this person may have some cognitive impairment. Having difficulty scheduling and keeping track of appointments, another classic warning sign, especially for someone who's always been so methodical and organized. All of a sudden, they can't keep track of appointments for the life of them. They'll show up the wrong day. They can't keep track of what appointment is when. They thought they called, they didn't call. They'll call the office several times. When is my appointment? So this will be a huge red flag. That's part of what we call executive functioning, and I'll talk a little more about that. Personal hygiene is another huge red flag for us. Wearing dirty clothes, having body odor, or not showering. Now, what is super key about that is that when we see that with someone who's always been very well groomed, always well dressed, always properly put together, all of a sudden their personal hygiene is lacking, huge red flag, because now they think there's no need to shower, they don't need to shower, or they think they have showered and they haven't. And it's really interesting, as dementia progresses, this becomes a huge issue. Their personal hygiene becomes something that becomes one of the biggest challenges in terms of taking care of a person living with dementia. Incorrectly taking medication or forgetting to take medication. Medication management becomes a problem. We will know that something is going on when all of a sudden a person is not able to take their medication, isn't taking their medication, skipping their medication, and it's consistent, right? We all forget now and then, oh yeah, I've got to take my pill at 12 o'clock, but I was so busy, I forgot. But you realize that you forgot. So medication management becomes a huge warning sign. If they're skipping their medication, they're not even aware that they skipped their medication, or they're taking their medication at the wrong time, this is a huge warning sign. Fixating on or ruminating about something, this is another huge warning sign. But let me elaborate on this. So I'm often called to go in and do informal assessments. And families will say, you know, I don't know how far along my father is, or my husband, my wife, whoever the person is. So I'll go in and have a conversation with that person living with dementia. And I'll give a specific example. I had a conversation with a gentleman who used to work on the roads. And we would talk, and he would tell me, I know so much more about the roads, the damage of the roads, and how to fix them properly. We had a wonderful conversation. But when I tried to redirect him, when I tried to bring up other subjects, other topics, he could not go with me. He had to stay in that lane. We had to stay in the area he was comfortable with, he was familiar with, and he fixated on that subject. So this is another thing that can get very confusing. You know, how do I know if my loved one has signs of dementia? Because they can talk brilliantly about something they know very well, but can you redirect them? Can you get them to talk about a different subject? Can you get them off topic and get them to refocus on something else? Often if they have impairment, you can't do that. They cannot go there with you. They stay in what I call their lane. They stay in an area that's very comfortable. And yes, from the outside, you think, oh my God, this person is so smart. They can't have cognitive impairment. Well, they're just stuck in a loop and they're staying in their zone. So the way to test if someone may have cognitive impairment is to see if you can distract them and get them to talk about other topics or other subjects. Another warning signs is will have problems with words, language, speaking, writing, or reading. This is classic Bruce Willis. This is progressive aphasia, right? Primary progressive aphasia. They'll have difficulty with words, language, speaking, writing, or reading. And in some cases, as dementia progresses, if you watch your loved one's signature, you're going to see a change in the signature, or when they go to write things. Sometimes what's normal print for them, you'll find gets very, very, very small, and it kind of, you know, there's some abnormalities into their normal signature. So this is a warning sign as well. And then having difficulty completing daily tasks. That is more than just starting something and then, oh, you got distracted and then you come back to complete it. This means they cannot complete it. It has to do with that sequential memory, right? I can't complete a daily task. I can't go in, take a shower because I can't go from the beginning all the way to the end. And if you think about showering, there's about 42, 45 different steps. I know that because I went through it for my book. So this has more to do with that sequential memory. It has more to do with executive functioning, some impairment that they cannot complete the task for the life of them. As a matter of fact, they'll kind of freeze, like they'll get stuck and they can't go any further. They just stop. And then withdrawing from family members and friends. This is often a common warning sign. Now, this can be a little more challenging to distinguish, but where we can really see the difference is when somebody's been super outgoing, super social, all of a sudden starts withdrawing, all of a sudden isn't comfortable going out to see people, doesn't really want to get together with people, and doesn't really want people to come over. They start to kind of go inward, and that will often be a warning sign of dementia. And then there's a few more that really help bring to our attention. Having a stack of unpaid bills or delinquent notices. Now, we all have different habits, right? So if you walk into someone's home and they're normally very, it's very neat, it's very clean, and you start seeing a stack of unpaid bills and delinquent notices, someone who's been very good about paying their bills and being very organized, all of a sudden you're seeing a stack of things. And that's something that happens when people get dementia. A lot of things just stack up. And now let's talk about a person who might be a hoarder. How do you know that difference? It's going to increase. It's going to get worse and worse and worse. And furthermore, they're not even aware of these stacks of unpaid bills and delinquent notices. They've just pushed them aside. So these are going to be warning signs. Unexplained weight loss, anytime we see that and there's not an explanation for it, medically, that's something you always want to check out anyway. We want to know, why is someone all of a sudden losing weight? And if it's unexplained, if there's not a medical cause for it, most likely it's because they're not eating or they don't remember to eat. So unexplained weight loss, I will say across the board, that's always something that you want to pay attention to medically and look into what might be going on. And then this may sound kind of silly, but sometimes when I go into a home to do an informal assessment, if I know that person's been living alone, I'll go to the refrigerator. I want to see what the refrigerator looks like. And if it's completely empty or full of expired food, that will be a huge warning sign for me. And I have to put that in perspective. I happen to live alone. I am not a cook. If you open my refrigerator, you're not going to see a lot of food, but you're going to see enough food in there to say, oh yeah, she's got food in there to eat. So, we got to put it in perspective. A person with cognitive impairment, signs of dementia, that refrigerator will be empty and or full of expired food. And then increased clutter here again, stacks of magazines, unopened mail. Again, you're going to see it increase, and it'll be not just on one table. It will start to be on many, many, many surfaces throughout the house. That's a warning sign. And then misplacing items and accusing you of hiding them or stealing them. This is common for people with dementia. They don't remember they moved something. So if you think about it, if I don't remember I moved something, then the brain's default is somebody else must have done it. You know you didn't do it. And so that will be a warning sign. They become very accusatory when they can't find something they're looking for, but you know they're the last one who had it. You know they're the ones who moved it. They do not remember that. Therefore, the default of the brain is to accuse somebody else for doing it or stealing things from them, right? So these are just some warning signs to really help hone in on what you're looking for to determine, are they signs of dementia versus normal aging? Now, what I really want to make sure I convey is that these warning signs, a couple things you need to know. It's not going to be a one and done. It's not going to be, oh, I saw that once. What's going to happen is that what you're observing and seeing is going to increase over time. The other thing I want you to keep in mind is these warning signs, make sure they're very out of character for the person, right? Make sure that's just very uncharacteristic for them not to know a word or to use a word in a sentence that makes absolutely no sense, no sense at all. So it has to be out of character for the person. And then also what you want to know is most likely they're not just going to have one warning sign, you're going to see several. There's going to be several warning signs. It's not going to be just a thing. And the other thing you want to know is by the time someone gets diagnosed with dementia, they've been symptomatic at least 3 to 5 years before they even get a formal diagnosis. So this is just to lay some groundwork to have you more educated in terms of things to look for. So I hope this information will help determine, again, what is normal aging versus dementia. Okay, so let me tell you the hallmarks of dementia, all right? The symptoms gradually get worse over time. They are not going to get better. Now, it may wax and wane for a little bit, but it is not going to get better. It's not going to reverse itself miraculously. So that is going to be one of the hallmarks of knowing when it might be a form of dementia. Then they have behavior or personality changes. So here's what I also want to say. If your gut is telling you something's off, I want you to trust your instincts. Something is probably off, but we may not know what that is, but I want you to trust something's off and maybe explore, and now let's look into it medically, what might be going on, because there are medical conditions that can mimic dementia-like symptoms, and I'll talk about that later on. Okay, then we have the familiar is no longer familiar. They don't know what items are for or how to use them. Let me give you some examples on this. So I have a client and she loves to garden. Her husband looked out the door the other day and she is digging with a spatula. She thinks a spatula is a little shovel. And then I have a client, their routine at night is to tell her husband, okay, let's go put our shoes in our closet. And he stuck the shoes in the refrigerator. So all of a sudden now, and that goes with that visual spatial perception is now impaired. And so they see things that aren't what they are, and familiar no longer becomes familiar. You no longer can go from point A to point B. You've done it 15 million times. And now all of a sudden you're somewhere that doesn't look familiar. That is a fabulous hallmark to keep in mind. And then they cannot do the 4 R's. I call them the 4 R's. They are not able to retrieve information. They are not able to retrace their steps. They are not able to remember short term, and they're not able to recognize familiar people, places, things, items. And then their cognitive changes have to interfere with daily activities. That's what you need to remember. The impairment has to be severe enough that it's interfering with daily activities. It's interfering with their ability to perform daily activities. Okay, so what I'd like you all to know as well is we have what is called 6 cognitive domains. And if there's impairment in one cognitive domain, that is enough to get a diagnosis of dementia. But I'm going to tell you, most often they've got impairment in more than just one cognitive domain. By the time they get diagnosed with dementia, there's more than one cognitive domain that's been impaired. But I want you to know what they are. So complex attention, that's where they can't focus, they can't absorb information, they can't concentrate, and then they can't even maintain the information. So we'll see somebody looking at a newspaper or a book or a magazine, and they may not change the page for a while because really they're not able to hone in on truly grasping that information and really absorbing what it is they need to absorb. So that's complex attention. And then we have learning and memory. This is where we're going to see the repetition, okay? We're going to see them repeat things over and over again. They can't retrieve information. They can't retain information. They can't remember information. They can't learn new information. They forget it very quickly. And this is going to be impairment in that learning and memory domain. Then language, when there's impairment in that domain, that's where we're going to see real problems with word finding. They don't understand the verbal and the written communication. But here's where it gets very complex. The words they use, they can't figure out the right word. Or, for example, I had a dear friend who got diagnosed with glioblastoma. It's a terminal brain disease, cancer. And his symptoms became very much like dementia. So I coached his wife on how to deal with these changes that went on. And he said, he kept pointing, I want that sausage over there, that sausage over there. He was pointing to a pillow that he wanted, but called it a sausage. So the language gets impaired. And then executive functioning, this is where they are easily distracted and they cannot planning is an issue, scheduling is an issue, they can't follow through, organization is an issue. They have difficulty with their time. They have difficulty wanting to know often, what time it is, when are my appointments. So this is the executive functioning that gets impaired. And then the perceptual motor control domain, when that becomes impaired, then we're going to see that things are no longer familiar. What used to be familiar is no longer familiar. Familiar faces, familiar people, familiar items no longer are familiar. And this is often when we'll know when they get lost going to familiar places. Well, no impairment is being caused in this particular domain as well. And then social cognition. When there's impairment in the social cognition domain, what we'll see is apathy. Apathy is a huge, huge, huge symptom of dementia. Very difficult to get them motivated and initiated in doing activities. That's apathy. That's a result of dementia, not because they're being difficult, not because they're being lazy, because truly there's damage in that part of the brain that's affecting them to be self-starters. They can't do it, again, not because they don't want to, because they really can't. And then this is where impaired judgment, this is where we'll see impaired judgment. And the other thing that happens when we have impaired cognition socially, inappropriate behavior. They'll say things that are embarrassing or that are inappropriate or insulting or hurtful. They are not doing that on purpose. They truly, truly are having brain damage in that part of their cognition. There's impairment in that part of the brain. And then also we'll see a loss of empathy. They won't have any feelings for anybody else. They've lost that empathy. that they can't do it. Dementia is a very self-absorbing disease, a very self-centered disease. And so they won't have the ability, for example, I have a client who just lost her best friend, and her husband have known this best friend for 50 plus years. And she was just sobbing and she was so upset. And she was telling her husband why she was so upset, so-and-so passed away. And he just had a blank stare, no emotion, no empathy, no nothing. And it's not because he didn't care. It's that part of the brain is now being damaged. So it's just a really good understanding of what's going on in the brain as dementia progresses. And the rate of progression varies from person to person. I can't tell you how many people will ask me, how long is this going to last? And it breaks my heart. I can't give you a timeline, because it progresses differently for every single person. But you will see a lot of common symptoms. And the more you know about how dementia affects your loved one, the better prepared and equipped you will be to deal with those changes. So you suspect that your loved one has dementia. Now, what do we do? First thing, you want to start documenting your observations. Write down the date, keep a journal, keep a log, write the date, write the time, and write down what happened. Let's observe, how frequent is this happening? Is it a fluke, or are there some patterns? Are there some triggers? Are there things that are going on? This is going to give you a real clear sense as to how often the behaviors are occurring. And I have to tell you, doctors love data. And the more data you have, the better. And it's going to allow you, your loved one, and the doctor, it'll bring clarity to exactly what you're seeing going on. Then I also, once you do that, and we think there's cognitive impairment going on, then you're going to want to ask for a referral to what we call is a geriatrician. That's an MD doctor who specializes in geriatrics, or a neurologist or a neuropsychologist, or sometimes we call them psychoneurologists. But these are the ones that are going to help you get the proper testing that needs to be done. These are the primary professionals that you're going to want to speak to about pursuing and looking into this further about what your observations might be a result of. Then you want to provide a detailed family history, and I mean a detailed family history. You also want to provide them with information that you might think is benign, but it's not. Did they ever have any accidents? Did they ever hit their head? Did they ever have a concussion? I was doing a book signing at an event the other day, and the gentleman shared with me that his significant other had gotten into an accident. And anyway, just a very sad story, and has now dementia, full-blown dementia, but so many other complications. And my first question to him was, by any chance, was he a bicyclist? And he said, yes. Why are you asking? I said, by any chance, did he have a lot of bike accidents? And he said, yes. Why did you know that? Because I had a sense based on the type of symptoms that he was describing to me. So if you have a loved one who's been an avid bicyclist and has had a lot of bike accidents, now, I'm not saying every single bicyclist who has an accident is going to get dementia. What I am saying is, think about anything and everything that has happened in your loved one's past, and you want to write that information down. In other words, you don't want to make any assumptions, rather than just give them a full detailed family medical history. Then you want to arrange for a battery of tests, and those tests are going to include blood tests. Today's blood tests are amazing, what markers they're looking for. And then you want to do cognitive and neurological testing to assess the thinking and physical functioning, okay? And the two you hear most often are the MMSE, the mini mental state exam. And then the other one you hear of often is the MoCA, the Montreal Cognitive Assessment. But you just don't want to take that one test and then, oh, now it's determined your loved one has dementia. No, we want to do a battery of tests. which are going to include brain imaging, MRI, CT, PET scan. They want to see what's going on in the brain. How much white matter do they see in the brain? And then the main reason we're doing all of this is we want to rule out other medical conditions that could contribute to these personality or behavioral changes you're seeing, because there are things that mimic dementia-like symptoms, urinary tract infection, dehydration, side effects of medication, thyroid imbalance, hearing loss, vision problems, depression. There's a lot of things, sleep apnea, because we want to rule out any possible reason why your loved one may be experiencing these changes. And if there's no medical explanation at all, then it can be determined definitively now that your loved one has dementia. So these are the steps to take if you do have concerns that your loved one may be showing signs of dementia. Follow these steps. That way we get you in the best care and the best hands as soon as possible, and do a full workup. And if they do get a diagnosis of dementia, then we can start planning ahead. There's medications that they can start them on, but more importantly, now we can start treating what's going on, and you'll have a better understanding. And then now we can prepare in advance for what's going to be coming down the pike. So anyway, I hope this was all helpful. And one more thing I want to do before I conclude is for us to read out loud this quote by Jim Rohn. On 3, please read this out loud with me, and then I want to make sure I have time for question and answer. On 3, 1, 2, and 3. One person caring about another represents life's most significant value. For those of you who are caring for a loved one with dementia, I do want to thank you from the bottom of my heart, as well as from your loved one, for all the love, the care, and the support you provide day in and day out. So now I would like to spend some time answering any questions if anybody has any questions.
Great. Well, we really appreciate that, Tami. I'm sure every participant appreciates that talk as well, and you shed a lot of light into dementia. I just want to encourage everyone to use that Q&A box at the bottom of your screen. Ask any questions if you like, for we'll be answering them. But I guess, I'll kind of start it off in terms of progression of dementia. What's like the timeline from, point A to point Z, like years, weeks, months, and, is there any way to slow down that progression?
So medications, we have Aricept, Namenda, and what's called Echelon patch. They're all about trying to slow down the progression. There's no cure. There's no medication right now out there that's going to cure it. So the goal is to provide the best quality of life for that person as this progresses. As far as a timeline goes, it's so very individual, right? I will say this, the earlier, if you're under the age of 6, early, what we call early diagnosis, early onset, the disease tends to progress quicker than later onset. So, but here again, it's going to vary from person to person. So what I tend to have people do, because often they'll want to know what stage their loved one is in, and I don't like to do that either because the symptoms fluctuate so much. But what you can learn from the stages is how it's going to progress. I can't tell you the finite timeline, but you'll have an overview of what you could expect as dementia progresses. And that's just the best way to answer that, because there is just no finite date. My grandmother lived with it for 21 years, but she was diagnosed with having senility. Back then, there was no such thing as dementia. Now, as a dementia specialist, oh my God, her symptoms were classic Alzheimer's. So there's no finite that's going to tell us definitively, oh yeah, okay, in 5 years. We can't determine that.
Yeah, great, thank you. We have a question. If you have a family member who you believe has dementia, but the individual believes that there's nothing wrong with them, how do you get them to go to the hospital to be diagnosed?
Yeah, that's a great question. And also that is very, very, very common. First of all, let me explain to you probably why they're not aware of it. So there's a medical term called anosognosia, ANOSOGNOSIA. And when there is impairment in the frontal part of the brain, that is where self-awareness is contained. If there's damage there, there's no amount of convincing, no amount of logic, nothing is going to get them to see that they have a problem. So we have to be very strategic in how we do it. And so what we do sometimes, and again, when I'm working with clients privately, I'll individualize a strategy, but in this case, I'm going to talk in generalities. We don't want to say they're going to the doctor because they have a problem or it's about them. You may want to combine an appointment and you're going to the doctor and, oh, by the way, we're scheduling an appointment with them as well. Another thing that works kind of pretty good too is to get some authority person, the medical doctor. If you got a good relationship with your doctor, have that doctor call and say, hey, I haven't seen you in a while. It's time for you to get a workup. But the minute you try to get them in there because you're telling them they have a problem, not going to work. It will not work because they don't see they have a problem. Why do I need to go to the doctor? And then what happens there, it creates animosity between you and your loved one. And we just want to avoid that as much as possible. So there are strategies on how we do that. I just gave you two kind of general ideas, but there's ways to do it. We just have to be incredibly strategic. But I will tell you this, do not tell them they need to go to the doctor because they have a problem. That is just not going to work, at least 99% of the time. On a rare occasion, it might, but it's not the norm. That's a great question. And it's a common challenge and problem.
Thank you. A couple more questions. As more scenario, after being accused of stealing their items, what is the best way to respond and keep all parties calm?
That is a great question. So what you need to know when they are accusatory, that is a classic symptom of dementia. And to the best of your ability, try not to take it personally. And we go along with it. Oh, I'm so sorry. Gosh darn it. I'm sorry I moved that. Let me see if I can find it, or I apologize. But you just go along with it. And I will say this, there are certain items that always go missing: purses, glasses, remote controls, wallets. And what we do suggest is you go buy a couple of them and you have extras. Don't let your loved one see them. And the minute an item goes missing, because the chances of you finding it can be slim, we're able to say, oh, you go into the other room, you pull out a wallet and say, oh, here it is. I'm so sorry. I misplaced it. I'll try not to do that again. Arguing with them, trying to convince them they had it, telling them you didn't do it. We want to spare you from that. Easier to go along and apologize. Oh, thank you for bringing that to my attention. I didn't mean to hide that from you. I must have misplaced it. Let me look for it. Just take ownership of it and try not to take it personally. I know it's much easier said than done, but truly remind yourself that anything that your loved one does because of dementia, that they have no control over it. They truly, truly, truly believe what their brain is telling them. Truly believe it. So we have to now develop what I call a new skill set on how to interact with them, because their brain now is altered and we have to now interact with them differently.
Yeah. I think we have two more questions I think we have time for. I would probably have to be brief, but one of them says, my father has rapid onset of dementia. He's coming to stay with me until a place opens up in his choice of memory care home. And I'm wondering, are there any activities I can set up to entertain him?
Oh, gosh. There's a couple of things you could do. Actually, if it's local, you may want to get him involved in Hearts and Minds, which is right down the street near Valley Medical. There are some daycare centers. There's also Live Oak. But yes, all you have to do, and my book has a list of them as well. As a matter of fact, I'm going to recommend you get my book. it is going to be a lot of work having him stay with you. And you want to be as prepared as possible, and bless your heart for taking him in until a place opens up. You can find activities, just type it in on the internet, and a wealth of activities will come up for people with dementia.
Great. And last question here. My mother lives 3 hours north of here, and I think they have dementia. How can I convince her to move closer to me so I can help her? Right now, I drive to see her and I am exhausted.
Yeah, that's hard. There again, that would be something that I would work with you on privately, one-on-one, on how to do that. But way to position that, again, I'm just going to talk in terms of generalizations. The way to position that is, I love visiting with you, and the traveling is getting really hard, on me. In other words, make it about you, come up with a reason or reasons you want her to live closer to you because she's special, how much you love her, how much more you get to spend time with her. In other words, make it very appealing and make it feel she's very important and very, very special. And having her closer to you, there's going to be a lot more time you can spend with her, and how much you want to spend more time with her. Basically compliment her and make her feel really, really good. And don't make it about dementia. Don't make it about, I need to keep an eye on you. Make it all about how having her closer to you would be such a wonderful thing for you and for her. And do not discuss the limitations that you're seeing with her, because they often get incredibly defensive. So we've got to be very creative in how we make it appealing and wanting her to come and move closer to you. And so we have to be creative in how we do that.
Great. Well, it is 12:01, so we're a little
Okay.
over, but I'd like to thank everyone for coming out. Tammy, thank you for taking time of your day to speak with us. I'm sure clients of Silicon Valley Wealth Advisors and everyone here really appreciate your talk. Before we depart, I just want to let everyone know that we do have a survey at the end of this, just to get your feedback on the webinar and get some future topics that if anyone wants to talk about, we could have a webinar on that as well. And with that, I will let everyone go. And thank you very much for spending time with us.
Thank you, everybody, for attending. And thank you, Tracy, again for having me.
All righty.
Okay,
My pleasure.
everybody
Thank you,
take care.
Tammy.
All right. Bye, everyone.